Hysterectomy is what's called definitive therapy, meaning that someone has tried other options for management, such as medications, birth control, and all of those options have failed and have not caused the patient to have as good of an effect as they desire. So whenever someone wants to have the most comprehensive and complete treatment, so to speak, they know that they're done with having children, hysterectomy is an option. Okay, so we perform almost all of our hysterectomies minimally invasively, meaning that we do it without the use of a very large surgical incision. My specialty is laparoscopy, which is using small incisions and cameras to be able to do the surgery, meaning that the patient has very, very tiny incisions, usually just closed with skin glue, and they're back to work very, very quickly. My patients always actually go home right after the surgery, meaning they don't even need to be admitted to the hospital. So a lot of patients hear the word hysterectomy and they get very scared. They think about something like a long hospital stay, a lot of time off of work. They think about things like hot flashes. They think that they're going to go into menopause. And we always try and reassure patients, in fact, that we actually don't take the ovaries. The ovaries make the hormones. And so the only thing that's being removed in hysterectomy is just the uterus. And the only purpose of the uterus is actually just to hold a pregnancy. So, someone after hysterectomy, should not have significant issues with hot flashes, should not feel like they're going into menopause. All that happens is that the periods stop, which is usually such a wonderful thing for these women. So, like I said, we like to reassure patients that, when they hear the word hysterectomy, it sounds very scary, but the actual experience is actually, quite straightforward. Or patients always comment very, very commonly, almost all of them, that they feel like their recovery was much easier than they thought it would be. Like I said, they don't even need to stay in the hospital. And by the time I see patients for their follow-up visit in 2 weeks, they're all basically back to their regular lives, work, activities. And so it's a very quick and easy procedure. And if patients have symptoms or issues such as fibroids, we obviously welcome them to come in for consultation so we can discuss all of their options with them.